The AusHFG are a key resource for health infrastructure development in Australia and New Zealand. They are informed by extensive research, technical review, and user consultation, providing a well-developed starting point for briefing, planning, and design. However, they do not replace the need for consideration of the local jurisdictional context and local service requirements. The AusHFG are not intended to restrict innovation that might improve performance or outcomes, or to be prescriptive where clinical service circumstances can validate an alternate configuration. The AusHFG provide a foundation of rigorously tested designs to support the delivery of safe, efficient, and functional health facilities. This enables project teams to focus on opportunities for innovation and further refinement to deliver optimal outcomes for the service. Across the 9 AHIA jurisdictions, when it comes to the use of the AusHFG, the approaches taken vary. Some jurisdictions have specific policies, while others integrate them into their project management processes. Depending on the jurisdictions, there may be specific documentation requirements and approval processes for AusHFG variations or deviations. The AusHFG are developed through a rigorous process, and it is important that proposed variations are thoroughly tested prior to being applied. Variation requests are analysed to assess potential impacts on service delivery, models of care, safety, cost, design quality, and the overall project program. Documentation outcomes from various requests also contribute to future updates of the AusHFG, creating a valuable feedback loop. The AusHFG are to be used in conjunction with other national and jurisdictional resources, which may take priority over the AusHFG, such as the Australia's National Construction Code and the New Zealand Building Code. Accessibility legislation, relevant standards, jurisdictional engineering services guidelines, and local policies. At a project level, the guidelines and policies are translated into a physical space. A clinical services plan developed through local consultation will underpin a project's facility briefing and planning design process. It will outline the range of services to be delivered, level of care, service capacity, and endorsed models of care. Briefing of facility-wide support services such as pharmacy, pathology, and back-of-house services and their operational models is also vital to guide project teams. Briefing, planning and design, engaging with stakeholders, identifying unique contextual requirements, and testing designs with users ensures the facilities will be adaptable to meet local service needs and respond to community and cultural requirements. It is the role of the project team to identify specific project requirements, including innovative practices. The AusHFG provide an Australian and New Zealand best practice approach to health facility planning and design. While these guidelines provide a strong foundation, it's important to balance these with local consultation to meet the unique needs of each community and healthcare setting.